everyone, welcome back to my channel. This is Nurse Eva again, and today's vlog, guys, will be talking about the clinical adaptation assessment. I know that there's a lot of nurses out there, especially from the Philippines, maybe who have pending application here in Ireland and maybe still planning to apply here in Ireland. So just to give you an overview, what is the clinical adaptation? If you're interested, please continue watching. So as I've mentioned in my previous vlog, there are two ways in how to become a registered nurse here in Ireland. It's either you would take the RCSI aptitude test, which is a bit quicker because once you pass the exam, you will get your license and you will be recognized as a registered general nurse here. And the second way is to undergo the adaptation period, which will take 6 to 12 weeks of clinical placement. Alright, and since I underwent the adaptation placement, so I'll be talking what should you expect when you will be under adaptation period. Right, first guys, we will just discuss first what is a clinical adaptation, why is it being implemented by the Nursing and Midwifery Board of Ireland. So according to NMBI, the purpose of the clinical adaptation assessment is to ensure that the registered nurse or a pre-registration nurse becomes eligible for the registration. And in order to become eligible, the candidate nurse must achieve competence. So what does it mean, guys? Competence, so what does it mean? So according to NMBI, competence is defined as the ability of the registered nurse to practice safely and effectively by fulfilling his or her professional accountability within his or her scope of practice. So which means that a pre-registration nurse must have the ability to accept responsibility and accountability for your practice, and ability to ensure that competency is maintained by ensuring professional development. Okay, and competence also incorporates the skills of interpersonal skills, effective communication, practical and technical knowledge, and organizational and management skills. So according to the Board of Nursing, in order to become a competent practitioner or registered nurse, the pre-registration nurse is required to demonstrate certain areas during their training or placement. So there are 5 areas, and these are referred to as the domains of competence. So what are these domains of competence? So these domains of competence are being used in order to assess the performance of a pre-registration nurse if he or she is already competent to become a fully registered nurse here in Ireland. So let's talk one by one about these domains. So number 1 is the professional and ethical practice. So you have to ensure, guys, that you know your roles and responsibilities, and you will only do things within your scope of practice. And please be reminded that you are still under the pre-registration, so you have limitations, guys, when it comes to your practice, okay? And second is the holistic approaches to care and integration of knowledge. So this domain of competence is applicable, especially if you encounter a new admission in your unit. Say, for example, if you receive an internal transfer from ICU to your unit. So I work in a cardiothoracic department, so usually receive patients from high dependency cardiothoracic department. So as part of this domain, you should know how to admit a patient and what's the flow of the admission, and you also need to remember all the paperwork, and you should study everything. It comes to the planning, the organization of your charts, and of course how you will organize the data of the patients given to you. And number 3 is the interpersonal relationships. So from the word interpersonal, guys, remember that you're not alone in the unit where you're working. So you'll be dealing with different members of the team. You'll be dealing a multidisciplinary team, which involves the doctors, the nurses, the physiotherapists, the dietitian, pharmacist, even the family members, even the lab technicians, the anesthetists, and your managers and your colleagues, So you have to be a good team player, guys, okay? And that's very important. And number 4 is your organization and management of care. So how do you organize your care and how do you manage a certain condition? So you have to be meticulous when it comes to prioritizing your patients. Say for example, if you have an emergency situation, you will be tested. How do you react to that certain situation? Please be mindful, guys, that as a pre-registration nurse, you have to be very careful in everything you do and make sure that you are under the supervision of a qualified registered nurse, which can be your preceptor. Alright? And number 5 domain is the personal and professional development. So what is this domain? So this is very important that as a pre-registration nurse, you should keep yourself educated, alright, and updated. So if there's any new machine inside a unit or if there's any update of a new procedure, you should be assertive and proactive, alright, to your facilitators or to your managers or to your senior nurses, that you're willing to learn, alright, and you're willing to listen. And so you will be updated with the new equipment in the unit. Alright guys, so these are the domains of competence that you need to remember all the times. In every assessment, you'll be assessed based on your performance according to the domains of competence. So this is very important, guys, that you should also do a research. I would suggest that you go to the website of NMBI, and that is nmbi.ie, and you can check the scope of practice of nurses in Ireland. So in that way, you'll be given information ahead of time and you know where you're going and what you're supposed to do once you're ready here in Ireland. Okay, so aside from that, you should expect that you will have assessment meetings. Okay, so what are these meetings? So it's divided into 3. So you will have an initial meeting where you will establish your learning contract with your assessor or your managers in the unit. And second is your intermediate meeting. Alright, and lastly is your final meeting. So what should you expect, guys, during these meetings? So these meetings, these are the times that you'll be assessed by your preceptors or your assessors. So each candidate nurse or a pre-reg nurse will be given a competency book or assessment book, alright, that you need to complete, and that book will be submitted to the NMBI once you finish your clinical placement. Okay, so during your initial meeting, guys, it's the first meeting where you will establish your learning contract with your manager or your assessor. So what should you expect working in that unit during your placement? An intermediate meeting, so it's the other meeting that you'll be assessed according to the domains of competence. How are you progressing well? Are you doing well in the past few weeks of your placement? And you'll be given some comments. It could be positive comments or negative comments from your preceptors or from your assessors, but it's a constructive criticism, guys, so it's for you to grow and to learn as a pre-registration nurse. And lastly, the final meeting, so that's the judgment day, guys. So you need to excel and you need to prove to them that you are a competent nurse, and so that they will pass you and they will give you a good mark. So once you get the competent result of your final meeting, congratulations, guys, you'll be a registered nurse soon. So you just need to wait for your certificate from the NMBI in order to be fully recognized. Okay, so that's it. So that's the overview of the clinical adaptation, and of course I'll be giving you some information as well that within the clinical placement you'll be doing medication rounds, and you are required to do 10 medication rounds. So what is this medication rounds? So it's just like when we're in college, guys, during our affiliation in the hospital. Like you need to do drug study, and then when you give medication to your patient, the preceptor will ask you, what is this type of drug? So say for example, and bisoprolol. So what is the classification of this drug? It's a beta blocker, and what's the action of it? So yeah, that's the medication rounds, and of course using the 10 ways of administering medication. So you identify your patient properly and check if the patient has any allergies. So you'll be assessed according to that as well. And aside from that, as I mentioned, since you are a pre-registration nurse, so you have a preceptor in your duty, okay, and you are the preceptee. So you'll be under the supervision of a registered general nurse, and you have to make sure, guys, that you're just doing things within your scope of practice. Since you are still under pre-registration, so you're not allowed to give any IV medications. All right, you're not even allowed to mix IV additives, like if the doctor is ordering potassium chloride 20 millimole mixed to 100 ml of normal saline. You're not allowed to mix it yet, okay? Just be very careful. You're only allowed to give oral medications, and of course with your preceptor. And you're also allowed to give subcutaneous injection, all right? But it's under the supervision of your preceptor. Okay, all right, that's it. And my next blog, guys, I'll be talking about some tips on how to ace your clinical placement. And I hope you learned something today, and that will give you an overview what a clinical adaptation is. And if you like this video, please click the like button below, and if you haven't subscribed to my channel, please don't forget to subscribe. Thank you so much for watching, and keep safe.